So for this video, we're going to be talking about kind of some patterns of the flow and loading and weight shifting, kind of distribution patterns and shifting patterns. So we're going to kind of be thinking about when we're more squatted versus when we're more extended or when we come up out of that squat. So first, we're going to pull back into the buttocks here. So I'm going to push my hips back. I want to think of like a seatbelt here, kind of pulling back into my hips, buttock, going back to my heels or past my heels, depending on how deep I'm going, like a skier. And my knees are going to be going out towards pinky toes, and maybe forward, depending on how deep I go. I'm going to be kind of collapsing there. But more back and out. I do not want to be buckling in like this, especially when I go deep. So I'm going to parallel that with what I feel in my feet. Hips back, knees out, more back. So I'm going to think about more like my back pockets. So I'm trying to get my weight lower in my body and then my heels going down. It's like a wishbone staircase. If you're really familiar with the movie Gone with the Wind or something like that, it's a very old movie, of course, but like a big sweeping staircase in like a mansion. It's this big kind of sweeping staircase along like this. So this kind of around, back, behind to the back pockets and down to the heels. So down and back, both sides, and mirror image. And then when I come up, I'm going to be pulling in, inner thighs, toe, big toe knuckles, squeezing in, drawing up through those inner thighs. My quads are going to be engaging more at that point, and pulling into my core as I pull in and up like the tube of toothpaste, squeezing in, up, channeling it in through my center. So back around down the hips and the heels, in, up through here, center, up through. If I was picking something up, I'm sitting back in my hips and heels, pulling in through my core and channeling my chest forward towards my big toe knuckles and driving up and forward, reaching, lifting up over my toes, not past my toes because I don't want to tip or fall, but I'm really driving forward. If I'm walking, I'm kind of driving back. My momentum is forward with my chest, where my weight is always going forward, but I'm still, as I come across, I'm loading, pulling back, and then coming up and around and through, but I'm always coming, the direction of the flow is back down to the heel, up and around through the breast pocket. So it's the rear pocket, back pocket, up around through breast pocket, back pocket, breast pocket, back pocket, breast pocket. So that's an easy way to kind of start to get a sense of that flow. And another nice little pointer is that when I'm going down, I don't want to feel too much tension in my thigh here. We have a tendency to think like it's a lot of quads when we're squatting, but really the quads are going to be more important as we come up out of the squat. And that's important, especially if you have knee problems. You don't want to overload that area there because that's where you're going to get too much compression in the patellofemoral joint. And that's where you might be actually jamming, pulling your kneecap up too much and jamming it into the condyles of the femur. And that's where you can be getting some of your knee pain, knee problems. So we really want more glute tension here, loading back in those hips, and loading as I lunge my knee forward and out towards my pinky toe knuckle. I want to get that tension, that load into that soleus muscle. So I want to feel those strong muscles of the gluteus maximus. Maybe push out with that knee out and get the medius a little bit, so the glutes in general, and then that soleus, and feel the load there rather than too much into the quads and in my knee. I don't want to stress the knee out too much on the way down, but I do want to get it to piggyback off of that as I connect to the quads and the inner thigh. So as I go back to the back pocket, I'm thinking more of my sciatic nerve distribution, all the muscles back there and the back and the outside. And as I pull in and forward, that's more femoral nerve distribution. So there's crossover. It's not just one or the other. It's more, I'm getting everything firing, but I'm more biasing sciatic in the back pocket and then femoral up and in towards the breast pocket. Hip, heel, sciatic, inner thigh, quads, core, femoral to the breast pocket. And that's where you can kind of get a good flow going there.